My name is Marina. I live in Porter Ranch, California. I'm 46 years old. Currently, I'm diagnosed with a 1.3 centimeter nodule, which is highly suspicious for papillary cancer. I would like to try to save my thyroid gland. And my only option that was given by mainstream endocrinologists was total thyroidectomy.
Hi, my name is Dr. Nikravan. I'm a clinical endocrinologist and a thyroid interventionalist. We have done over 100 cases of thyroid radiofrequency ablation, and majority of all the cases have been either on benign nodules or toxic nodules with amazing results, ranging as little as 40% reduction to almost 98% reduction in volume and size, which has been very impressive. We are looking forward to publishing our data regarding thyroid micropapillary carcinoma, reduction in size and tumor, as we have recently started doing these procedures. I met Maria through our practice. She reached out to me. She said, Dr. Nikravan, I have a thyroid nodule, which is a bit concerning, but the caveat is that the biopsies have been a bit suspicious. So we brought the patient in and we looked at it and we re-biopsied the thyroid, and we noted there was some suspicious characteristics on the thyroid which favored thyroid cancer. The problem was that the literature that we are familiar with right now, which is extremely promising, looks like micropapillary cancers less than 1 centimeter. Unfortunately, Marina's tumor was 1.3 centimeter on the isthmus. We evaluated the patient very carefully and we realized that there were no other lymphadenopathy, no other abnormalities through further imaging consistent with CT and PET scans. And the patient was very eager to proceed with the thyroid radiofrequency ablation. She even considered going out of the country and get the procedure done. So after evaluating the patient, telling the patient about the limitations of the data that we know at this point, we elected to move forward with her thyroid radiofrequency ablation. At this point, we're very excited to be the first center that we are aware of to attack the tumor at 1.3 centimeter, at least in the country. We're very excited to be able to offer this therapy for her because not only that she really wants it, she wants to preserve her thyroid. And our goal is for her to eradicate the tumor by destroying the tumor, all the margins, and using a hydrodissection technique by lifting the nodule off the trachea and going forward very carefully and precisely with probably between a 5 to 7 millimeter probe at that point. As you know, if you guys have met Marina, she's quite a lovely patient and quite determined to go forward with the thyroid radiofrequency ablation. And I think she wants to set the segment for a new therapy protocol for patients who have thyroid cancer, who qualify as another option rather than just simple thyroid surgery. Typical standard treatment for thyroid cancer is most likely complete resection of the thyroid or half resection of the thyroid, depending on size and the tumor characteristics. At this point here, we're looking for tumors 1 or less centimeter or maybe marginal to that point. If we can accomplish the goal, as we should, the patient can be rendered from the tumor, which means no general surgery, no general anesthesia, no scar, no hospitalization, no medicine afterwards, no radioactive iodine afterwards. Of course, these patients must have a very careful assessment and evaluation to making sure that they do not have metastatic disease to begin with and the tumor is confined to the thyroid gland itself. This is a good criteria for the patients we actually search for initially. People ask, I have thyroid cancer, what would be the criteria? I think the best criteria we said right now is tumors 1 or less than 1 centimeter confined to the thyroid gland with no lymph nodes, no other abnormalities around the neck associated with the thyroid cancer. And the treatment protocol is very straight, it's very quick. The treatment protocol probably lasts less than 5 to 10 minutes. Of course, the prep time is much longer, but the treatment with the radiofrequency is quite quick, especially if the tumor is quite small. What we do is we focus on damaging the tumor from the periphery and inward by destroying all the margins of the tumor and also inside the tumor itself by getting rid of all the abnormal tissue. We follow up these patients typically every 4 weeks to every 3 months for nodule resection. And so far, the follow-ups at 4 to 8 weeks look very impressive with 25 to 50% reduction in as short as 4 weeks and up to 50% reduction in 8 weeks, and down to 6 months, the reduction is almost at 95+%. and resolution of the tumor is what we're shooting for, as we've recently started doing this procedure. Marina asked me, Dr. Nikravan, if there's anyone qualified to do the procedure, it would be you. You should do the procedure. And I said, Marina, we haven't done a procedure of a tumor more than a centimeter. This is quite new. Therefore, she said, Dr. Nikravan, I've looked up your data. We know about this, and I think the best thing is to go forward. Marina convinced me that we should at least attempt a thyroid radiofrequency ablation period, and excited to move forward in this new journey as another option for those patients who choose not to proceed in the route of thyroid surgery. Thyroid surgery is a quite safe procedure. Of course, it does not have a zero risk factor. Of course, there's always risk associated with it. As endocrinologists, we see the post-op follow-up thyroid cancer patients who have multiple complaints of neck contracture, difficult bad neck scar, and possible vocal cord irritations and damage, and possible calcium metabolism abnormalities. Therefore, if we can offer a procedure that is highly effective to eradicate the tumor, why not? And this is why we decided to go with Marina and proceed with this treatment protocol for her, known as the thyroid radiofrequency ablation for her thyroid cancer, which is at 1.3 centimeters. We're very excited to partake in this patient's journey, and we are hoping to get the word out to more patients and more physicians about other options regarding this management. Thyroid radiofrequency ablation was FDA approved around October of 2018 and is a highly safe and effective therapy if done by the right technique, period. We have done over 50,000 ultrasound-guided biopsies, so we have an extensive amount of experience and training regarding the anatomy of the neck. So therefore, we feel comfortable and confident that we will be able to do a great job regarding the procedure for her.
I am super excited. I feel so fortunate and so lucky to be the first patient who actually undergoes this procedure. I hope we're setting a path for a brighter future for a lot of patients and a lot of doctors.